And here's what I found. I'm going to focus primarily on etiology and pathophysiology and then on treatment and the clinical aspect for you all. There are many forms of cancer, and cancer represents a failure of natural processes. Now that one, you'll understand that one better today after having had the lecture this morning. Most people, that's a challenge. I think you're going to find it, some of the things I talk about will be familiar to you now. Chronic irritation is a primary etiological factor, a primary causal factor for cancer. Cancer is an entity unto itself, and cancer draws from the vitality of the body. Okay. In a couple of the readings, Cayce said there are many kinds of cancer, 19 as we find. Interesting. They can arise from glandular or organic disturbance, or infectious forces, or bruises. Pay attention to that one, you musculoskeletal people, bruises. Okay, from all the various natures from which these come, each having a variation according to that portion of the system or its cycle in which the affectation takes place. So there's your non-specificity, and in each system it might play out in a slightly different way, and it depends on what part of the system it occurs in. See, there's variability there and non-specificity. Cancer as a failure of natural processes. What did he mean by that? Well, someone asked him, are there any symptoms of cancer in the system? And he said, no symptoms of cancer. Remember, for every individual physical body might be sometimes called symptoms of cancer ever present. But the breaking of cells, injury to some portion of the body, these are usually the sources and the activities that bring about such. Okay. So basically saying, in most of us all the time, there's something like a cancer process going on. Our systems handle it. It's not a problem. But if there is a breaking of cells or injury, that's back to that bruising and so forth. And he says, well, that could be one of the things that would trigger it over into a malignant kind of status. Okay, so what is the normal healing process? We talked about some this morning about coagulation. You remember that? As part of the normal healing process. Injury or disease produces toxicity in the system because you get accumulation of acid, dross, or broken tissue. So you injure yourself somewhere. And that area is with this process of separation or segregation of toxicity. Remember when I talked about coagulation this morning, I said it's not just clotting, it's part of the whole wound healing process where you either have injured tissue or maybe have a lot of toxicity, because you will get the buildup of toxins when you get an injury because there's less blood flow there very often. And the system segregates or separates. Those are terms that you find a lot in the cancer reading. They sort of wall it off. He'll use that kind of term. Wall it off, isolate it, so it limits the damage. And the toxicity can't affect other parts of the system. And then there's an absorption through the local circulation. That's sort of the drainage process, you see? Drainages that cleanses the tissue and removes it. So the coagulation process encases it, and it gets eliminated. And you have the 4 primary channels of elimination to get it out from. This is all in the report that's on our website too also. You can look this up in our report if you like. And then also, as part of the healing process, you get increased production of cells to replace damaged or diseased tissue. So wall it off, absorb it, and then regenerate new tissue, so you get more cellular division and so forth, to replace the damaged tissue. That's a normal wound healing process. That happens in us all the time. We don't have to think about it. That's why Cayce says this kind of process is going on all the time within us. But what causes it to cross over and become cancerous? The typical cancer process. Again, there's all different forms of cancer, so this is not in every case, but you'll find this a lot in the Cayce readings. The first 2 are the same. You get an injury or a disease process, there's toxicity in the system, you get the separation or segregation that goes along with what he described as coagulation. However, number 3, depletion of the system, low vitality due to chronic illness or lifestyle choices. So the system doesn't have this elan vital, this vitality to handle the toxicity or this segregated part to be able to absorb it and get it out of the system. It can't do that. So you have the inability to absorb or eliminate the toxins or disease. So it stays there in this chronic irritated state. Might result in something like ulcers or tumors or other forms of broken tissue. Did we see that broken tissue earlier in that quote? something like that, or broken cellular matter. This is the language of cancer, by the way. And these become localized or centralized. In other words, rather than becoming something that's sort of temporary, they sort of take up residence. This local irritation, this isolated, segregated separation, takes up residence and sort of claims that area and it's localized or centralized as its own territory. Then, if in addition to that, that usually in itself is not enough. That might produce a non-malignant tumor maybe or something of that nature. But if in addition to that you get chronic irritation and some type of outside source, if the irritation of some type of outside source such as bruising, I think cigarette smoking to the lungs is probably, that's one of the things it does. It's the chronic irritation over years and years of having that irritation makes that part of the system more susceptible to cancer, the process we're talking about. We're going to cover some of these in detail in a little bit. You get a creative force produces abnormal production of cellular units. Now, part of the healing process was the division of the cells to produce more cells, correct? I mean, that's part of the normal healing process we saw earlier. You need to replace that damaged or injured or diseased tissue. But in this case, the reproduction process sort of gets out of control. And the segregated tissue takes on an identity of its own and becomes a parasite on the host, competing for energy and nutritional resources. That's when it crosses over and becomes an entity unto itself. In some instances, the segregated tissue spreads or metastasizes throughout the host system. And at that point where it crosses over and becomes an entity unto itself, that's different than almost any other condition in the body. In almost every other condition in the body, the system is viewed as a whole that has the potential for bringing things back into harmony and coordination and absorbing toxicity to eliminate the problem. But if it becomes an entity unto itself, competing for the vitality of the system, then Cayce would say, if it gets too far along, and particularly if the vitality is low, you might need to eliminate this parasite on the system. You might need surgery, you might need radiation, and we're going to look at those as therapeutic options a little longer. You see the difference there when it becomes an entity unto itself. It's like a parasite on the system. It's not part of the system anymore. It's operating on its own rules of survival, and it's competing with the system to survive.